Before we begin, let's make sure we have everything we need for your injection. You'll want your weight loss peptide vial. Make sure you have the correct peptide prescribed by your healthcare provider. Our compounding pharmacies send Semaglutide or Subcutaneous to your doorstep. Next, you'll want your insulin syringe, either a 1 ml syringe with a short, fine needle, typically a 30 to 31 gauge, with unit markings for easy dosing. You'll need alcohol swabs to disinfect the vial and the injection site. You'll want a sharps container for safe disposal of your needles and syringes, and a gauze in case of any bleeding at the post-injection site. Start by washing your hands thoroughly with soap and water or with hand sanitizer rub. Clean hands are essential to prevent infection. Next, take an alcohol swab and clean the top of your peptide vial. Insert the needle into the vial and pull back on the syringe plunger to draw the prescribed dose into the syringe. Be careful to draw slightly more than needed to account for any air bubbles. If you notice any air bubbles in the syringe, gently tap the side of the syringe to bring them to the top. Then push the plunger to expel any air. Ensure you have the exact dosage remaining in your syringe. Subcutaneous injections are typically administered into the fatty tissue just beneath the skin. Common sites include the abdomen at least 2 inches from the belly button, the thigh, the back of the upper arm, or the hip area. Today we'll demonstrate injection in the abdomen, which is a popular and accessible site. After selecting your injection site, disinfect the area with an alcohol swab and allow it to dry. Gently pinch the skin around the injection site to lift the tissue. Insert the needle at a 90-degree angle to the skin and slowly push the plunger to inject the peptide. Take your time to ensure the medication is delivered smoothly and fully. Once the injection is complete, remove the needle at the same angle it was inserted, apply gentle pressure with gauze, and if necessary, you can cover the site with a bandage. Dispose of the used needle and syringe immediately in a sharps container to maintain safety. It's normal to experience mild discomfort or a little bit of redness at the injection site, but this should go away quickly. If you notice any significant swelling, redness, pain, or if you experience unusual symptoms, contact your healthcare provider right away.